So it's nice to see all of you in person today. My name is Josette McConville, and I'm with Nebraska ICAP. I'm an infection preventionist since 2000, and I don't know when, for quite a while. Along with being infection prevention, and even before I started that, I also worked in employee health at various jobs and throughout healthcare, and so managed needle sticks and bloodborne pathogen exposures, and did employee health for approximately 10 years. So today I am speaking about personnel safety, and so a big portion of this is going to be about like risk for potential exposure to blood and body fluids and how to manage that. And I know it's a completely different bird. I always had the luxury of having the lab about like 40 foot from my office, so if anything ever happened, I'd be like, just go to the lab. And, but it's different when you're, not in that healthcare setting. So we'll be talking about how to manage those types of exposures and then how to hopefully prevent those types of exposures. Again, I work for ICAP, background in employee health, but non-regulatory. So we'll be talking like a lot about OSHA and certain rules and stuff. I learned a lot through trial and error over the years and reading OSHA regs, annually or more for years. But if you have any real difficult questions for me, we aren't OSHA, we're not regulatory, so I'd probably have to get back with you and help you find the appropriate answer for those. So we'll start out with the bloodborne pathogens and looking at OSHA's bloodborne pathogen standard. OSHA is a branch of the Department of Labor. It creates safety standards for employees, mainly of the private sector. Except there's kind of a caveat to that because they don't oversee, they wouldn't come in and do like an inspection generally of like a county job, a state job, but if you've ever been kind of told, well, we don't follow under OSHA, so we don't even need to like deal with that, that's not necessarily the case because if you don't directly fall under OSHA, it means they would not come into your building, but there are state regulations that would expect that you have safety standards for your employees that meet or exceed the standards, that are put out for the private sector employee and what OSHA would be looking at. So essentially, even if true statute doesn't apply to you, something very, very similar would, and you would need to be looking at that. So OSHA Standard 29, the CFR 1030, is specific to bloodborne pathogens, and it does not only apply to healthcare settings, but it could be other jobs where especially first aid is rendered, a healthcare worker, there are nurses within the schools, other people that are assigned specifically the duty to provide first aid and may come in contact with blood and body fluids. So we'll be looking at especially how you'll potentially make those decisions as far as who is considered at risk in your school. But anybody that has potential for occupational exposure would be covered by this standard, and we'll talk about how you determine who that is. And then the actual standard talks about having an exposure control plan, which is a lengthy document that OSHA provides a simple template for that you can edit for your own needs and adopt. Talks about the use of universal precautions. I don't need to read through all these, but these are the things that we're going to be talking about in the upcoming slides, everything that falls under this standard. When we talk about bloodborne pathogens, generally we're specifically talking about the risk for coming in contact with blood or other body fluids, and then the risk for pathogens that are transmitted through blood and other body fluids, such as hepatitis B, hepatitis C, and HIV. There are other illnesses that could be transmitted through body fluids, but specifically with a needle stick or exposure to blood, these are generally the biggest concerns. So a couple of definitions here. Occupational exposure, I think this is a little confusing. Occupational exposure to me, I would have maybe said that when somebody actually had a needle stick, but it is really the risk of potentially being able to come in contact with blood or body fluids through your job. So reasonably anticipated skin, eye, mucous membrane, parenteral contact, meaning like a needle stick or something sharp that was dirty with somebody else's blood or body fluid, were to penetrate your skin through the performance of your job, it means that you have occupational exposure, I would add risk to the end of that then. And it's important when you're thinking about this that it's, that you look at that definition, because some people, don't like blood at all, or the sight of blood, or maybe blood on their intact skin would freak them out. But there's not going to be a risk for any, transmission of illness unless they're truly that blood or body fluid were to enter through the mucous membranes or through a cut that's not properly covered on someone's skin, or like a needle stick. The actual exposure incident would be when that happens. So the blood goes into somebody's eye, or your body fluid does, or there is a needle stick. So the most common exposure in healthcare is needle sticks. Probably in a school type setting, I wasn't necessarily able to find the most common exposure, but that's probably a lot less likely. So a lot less likely to probably have the exposure, even though there is that risk. But probably a lot of times thinking about and concerned with like first aid type situations and splashing and splattering. And there would be most likely in that situation, not protective eyewear and gloves and stuff immediately by me if I needed to respond. So those types of risks are there. So the exposure control plan, again, is kind of a lengthy document that OSHA says you have to have if you have staff that have this occupational risk. And it really just outlines everything in your plan. How you determine who is part of this, who has an occupational exposure in your school. So it identifies jobs and tasks where those exposures could occur. Talks about engineering and work practice controls that you hopefully have in place to prevent an exposure. The use of personal protective equipment, housekeeping, how any sort of pathogen is going to be, potential pathogen is going to be disinfected. How you're going to do training, what happens if somebody has an incident, that you have to provide hepatitis B to the people that are at risk for exposure. So this is, again, can be found as a template under OSHA. My very last slide, I have a bunch of resources you can click on. OSHA has some really, lots of resources. Sometimes they're kind of hard to get through because some of them they kind of write in a friendly manner, and some of them they write in a more lengthy, statute type manner that's hard to read through. But it's good to find the friendly manner ones. And there is a exposure control template that you can customize. And that the one word of warning I would say is if you have it in a binder somewhere, we have an exposure control plan, but you've never customized it, you really need to do that, because a big part of it is when somebody has the incident, who are they going to call? How are they going to find this information? Who are they going to call? What's going to be the actual protocol that you follow, not just this generic template. So how do you decide in your school who has this occupational risk? OSHA does have kind of a frequently answered question, or again, a more nice way of saying what their statutes mean. This is, I know, a lot of words on here, but it says we have employees who are designated to render first aid. Are they covered by the standard? And the short answer is yes, they are. So this is kind of a long list here, but yes, they are. So it is really up to each employer to determine who is at risk for coming in contact with blood and body fluid and has that risk. Some schools may decide every employee is. I mean, they may apply this very liberally and say, kids are going to get in a fight, they're going to cut themselves, every employee is. But it doesn't necessarily, you don't have to adopt that. You could have plans in place, where only specific designated people are the ones that are going to perform first aid or are going to be called, to, have that potential to come in contact. And then in that case, you would designate them as having that potential risk only. If somebody has in their job description that they that they're required to perform first aid, they absolutely would be, need to be covered and be considered at risk for exposure. So your nurses, your health paras, a lot of times maybe like a secretarial position that would be like administering first aid, or a team that you designate to do that. They should absolutely be included. If it's, you might want to take into account what age groups, does our staff work with, and, we're determining based on our own assessment, this group's more at risk versus this group. But, incidentally coming upon blood, though it's not part of your job, like, I work in the high school, I'm hardly ever, math teacher, gonna come upon blood, but somebody has a bloody nose and I have to help deal with that initially before we can get them down to the office. Doesn't put you, like, if that happened, it would not, this whole like long paragraph basically says you wouldn't be out of like compliance that you did not train that math teacher, or did not designate their job as somebody who had occupational exposure. You would want to have them have at least the training to know that if they ever had this happen, who to call, that it's an emergency, and who to notify. But it really kind of leaves it a little bit open to interpretation if it's all your staff or designated staff that you have that would be included. Talk about housekeepers, maintenance workers, janitors, are they covered by the standard? Again, job description, absolutely. If they are, like if there is a spill of blood or body fluid or something, and you have in your policy that the teachers aren't just going to clean it up, they're going to call the janitor to do this, then they should be absolutely covered by that standard. Every single person that's responsible for cleaning in the facility, if they aren't designated as somebody that's going to do that, then you may not have to have them, or again, you may apply it a little more liberally and say, yep, our entire facilities, housekeeping, janitorial staff is going to be, we're going to consider that they could have that risk. And again, I have the links on the bottom of the slide, and they're on my last slide also, but this just kind of, Nebraska has statutes that talk about bloodborne pathogen exposure, both in healthcare workers, but specifically this 71507 to 513 is emergency services providers and public safety officials, where like school personnel would fit. So the link down here would take you to that first 71507, and you could advance through those. But it really is, this is kind of where you would go, there's more specific guidelines in healthcare, and then this is where you would look at for your non-health care. And it's really saying, follow through like you would with OSHA. But this is kind of the state law. If somebody, is to say get someone else's blood in their eye, I'm at risk. We'll talk about, how they would report that. But ideally, the person that that blood came from we'd be able to test their blood for any pathogens like HIV and hepatitis. If they are told this is a risk to our staff, do you consent to having this done? The parent consents to having it done. That's a nice way to deal with it, and consent all around and not a big deal. If they would not consent, the statutes do outline like you could take it through court and get this blood specimen. A lot of times probably wouldn't necessarily go that far, probably with the medical evaluation. Kind of determining what is the risk here. The physician may decide to continue to monitor that person that was exposed and not go forward anymore. But that's where you would find the laws and information about that. So in the exposure control plan, OSHA leaves it open to, are you going to follow the definition for universal precautions or body substance isolation, which in healthcare, if you are the school nurse in here, we call standard precautions or similar to that. Universal precautions, this definition and information was put out by CDC in the 1980s in response to HIV. And it's an approach for infection prevention that looks at blood and only certain body fluids as being infectious. And things that would not be included for body fluids and universal precautions would be urine, feces, vomit, sweat, like nasal secretions, a lot of the body fluids that probably maybe a school personnel, working with a small child would come in contact with. But so that it's really specifically looking at blood and those things that would be transmit HIV or hepatitis. Body substance isolation, or we could say standard precautions, is the thought really that all body fluids, anything that's moist, everybody's favorite word, damp, wet, that you would come in contact with, has the potential for transmitting an illness. And really OSHA leaves it open. You can choose in your exposure control plan which one you want to educate your staff about for the definition and follow. The safest thing would be really following this body substance isolation or standard precautions that any body fluid that you could come in contact with could transmit potentially some sort of illness. And it's with the thought that you want to act like the person does have something. You want to keep yourself safe. If you're going to be touching something that's a body fluid, I want to get gloves on my hands so that I'm not coming in contact with that. But that there's always that risk for transmission. So part of the exposure control plan and OSHA guidelines is that anybody who is deemed to have this risk for occupational exposure should be offered the hepatitis B vaccine within 10 days of their employment. And if somebody's job description changed, you would need to take this under advisement. So say somebody is hired to work in the kitchen. They're not determined to have an occupational exposure risk to bloodborne pathogens, but switch jobs to being a health para, 2 years down the road. If their new job description puts them in this where you're deeming them at risk for exposure, at that time you would need to offer the Hep B vaccine. Exceptions would be, if somebody has a contraindication to it, if they're already have record that they are vaccinated, and they don't have to take it. They can decline to take it, but it needs to be offered, and then if they accept it, you would send them to get it from potentially the health department from a clinic, but it would be at the expense of the employer, not the person. The person would not be responsible for paying that on their own. And you would want to keep a record of that so that you offered it to them, that either they accept it and bring you back their documentation of their vaccine, or if they decline it, OSHA does have a just kind of standard declination form, and for appropriate record keeping, you would want to have that declination form on file in their in their personnel file, just to prove that you'd offered it. Part of the exposure control plan is looking at engineering controls, and so these are things that are can we just prevent a bloodborne pathogen exposure from happening versus, that are, more environmental than my actual use of anything. So probably it's widely variable depending on nursing jobs in school who has contact with needles. I know probably with a lot of, thinking about diabetics and stuff, with continuous glucose monitoring and insulin pumps, there's probably a lot less needles at lunchtime than there was years ago. But if you work with needles in your job, there should be a policy that needles all have safety devices on them. If you're using a needle on someone else, lancet, to poke a finger or something, lancets can be purchased where the needle retracts up into the plastic piece. If you're using some sort of hypodermic needle, there could be a sheath that goes over the needle, but the expectation should be that the needles you're using have safety devices that will help keep you safe. In the nurse's office, sharps, if you're using sharps or needles, there's some certain rules around sharps disposal containers. They should be puncture resistant, leak proof, properly labeled, meaning that, I should have put a little graphic on here, but that orange biohazard, kind of symbol, they should be labeled there and color coded, and that'd be red or kind of that dark orange color. In this office where any administration, injections are done. They should be as close as possible or to the person that's needing to get to that sharps container, and they should never be overfilled. And I do have a slide clear at the end. I don't know why I put them in the order I did, but about getting rid of those sharps containers and the expectation to do that safely. These are just a couple of infographics related to sharps use. And we'll talk a little bit more here in a few slides on training and really, if somebody is going to be using not just the bloodborne pathogen training, but if they're going to be doing things within their job that put them at risk, to really have a more comprehensive, competency-based training about using needles with a checkoff. So personal protective equipment, if a hazard can't be eliminated, the next step would be adding personal protective equipment to keep yourself safe. And I think this is a big opportunity for education that happens when somebody starts their job or annually, or if they're again transitioning to a different job where they may need to use PPE and didn't get the training initially. And that, a lot of times in schools, you're not going to wear gloves and gowns and protective eyewear on a daily basis or every half-hour basis like we do in healthcare. And so when the time comes that somebody needs to consider needing to use personal protective equipment, opportunity really to train here and even practice with it. But where is the PPE is very important, and if there's not accessible in a number of areas, I'm probably not going to traverse downstairs and across the building to get what I need. I'm probably just going to handle it how I need to. So is it available in safety kits in multiple areas of a building? When would I be expected to need to go get it? What should I choose to put on for PPE? I think an example would be, and I know we're talking about environmental disinfection later, so I don't want to get into other people's topics, but if you're cleaning up vomit, there is a risk for aerosolizing of germs. So, you could really just outline, if you're cleaning up vomit, the expectation would be that at a minimum, I'm putting on a mask, protective eyewear, and gloves. If it's a really messy situation, maybe that you have gown available because you wouldn't want somebody getting, whatever it is they're cleaning on their personal clothing. But for, again, people that don't use PPE on a daily basis, to really kind of spell out for them. If I'm cleaning up vomit, maybe I just have a little signage or flip chart that this is what I should put on. If I'm dealing with blood, this is what I should put on. If I'm changing diapers, expectation for the school is that you wear gloves. And then to maybe even do a little activity in your annual training about how do I put on gloves and how do I take them off safely so that I don't get whatever's on the outside of the gloves and gross and reinfect myself. But I think a good example to bring up to people is we've all been into, and in fast food restaurants, they aren't dealing with blood and body fluids, but they're dealing with really dirty money. And a lot of us have probably ate it somewhere where they put on gloves and you see them touching your food, and then they take your dollar bills, and then they go back and touch your hamburger, and they never take their gloves off, and kind of a good example of, I don't probably want to eat that. But it kind of a good example of to bring into real life, gloves don't make up for the need for hand hygiene. They're really keeping you safe, from touching blood, but that there's opportunity to change gloves when they get really dirty, and I don't want to be putting gloves on, having them contaminated, and then running down the hallway for something else. So when do you put the PPE on? Where do you take it off at? And so that you're not infecting other areas. It's lots of opportunities there. Good signs here. So again, I think, to consider, again, having those flip charts where your PPE is at. What should I put on when I'm cleaning up vomit? What should I put on when I'm changing a diaper? And then could have just some simple graphics, again, since it's not a day-to-day thing, on actually how to don it and take it off when you get to the point of needing to use it. Hand hygiene, again, covering after lunch, so I don't want to get into this too much, but I think with any sort of infection prevention training, your bloodborne pathogen training, anytime you bring up infection prevention, talk about hand hygiene a little bit, at a minimum. And going along with the PPE use, which those rules will be put forth by OSHA that you have the PPE, it's always that you would perform hand hygiene when you take it off, because you're always at risk for reinfecting, yourself or picking up those germs on the outside of the gloves, and to do hand hygiene. And so is it available? Probably in your little kit that you're going to go get for first aid, have the Purell or alcohol-based hand rub in there so somebody can use it before they have to go throughout the whole building, to get to the bathroom to wash their hands. I didn't mention on that last slide either that for personal protective equipment, again, needs to be, if you have people that are at risk for coming in contact with blood and body fluid in their job, you have to provide some personal protective equipment for them to use. It needs to be accessible to them, and it is free to them to use. And in general, PPE should be disposable. One-time use, you take it off, you throw it away. Nothing that is like washed and redonned. Oops. Going the wrong direction. So OSHA is specific about what should be included in annual training for bloodborne pathogen and exposure risk. And so training should happen annually, should happen when somebody's first hired, if they are at risk, should happen annually, and then again, if job requirements changed, didn't used to be responsible for first aid, now I am, we would need to do this training. Topics that are specific, and a lot of you, and this is, a great opportunity, use probably some sort of like computer module that's already been put together. And so an expert has put that together and the right information is in there. And I think that's great. I think the only thing that I would caution is to put your own, again, requirements, to make sure that your own requirements and your own facility specific plans are included in that. So OSHA is specific that the training should talk about, it says regulatory text, but essentially you're sitting in this training because OSHA requires it and because your job, you have been deemed to have this occupational risk, how bloodborne pathogens are transmitted. So it's going to talk about, you get it in your eyes, you could get it through a needle stick or something. That your facility, if you had this canned training, it would say your school has an exposure control plan. And then talks about the practices we talked about, how to use PPE, when to use PPE, how to wash your hands if you have an exposure, to wash it, and then to contact somebody in your school that is responsible. So I think the piece that is missing, and not just in schools, but even when we go to some healthcare facilities, is it's great to use that information that's already put together for you, probably is updated by whoever you purchase it from annually. But are you missing, who am I going to call if that happens to me? If I'm out administering first aid at recess tomorrow and I do have, it's a really bloody and I'm really concerned about something, do I know really what the plan is in my school? Who do I need to call? And to make sure that you customize that training. And I think the big part, if you're a person that is, putting on this training, whether it be starting the computer module and giving that customized part or doing the whole training, is to get people to recognize this is an urgent situation if you have an exposure. We want to do all that we can in the training to prevent an exposure, but if it were to happen, it should be treated as an emergency. And so follow the plan and let whoever you're supposed to know as soon as it is feasible to do so. So then they can get the ball rolling on the plan. Keep going backwards, even after I was trained. So at the point there is an exposure, again, there are OSHA templates for this, and I think this is an opportunity, if you're in charge of this in your school, to maybe do a little tabletop exercise, because an exposure probably, you have a lot of people in your facility that are deemed at risk, but an actual exposure probably happens so infrequently And then when it happens, and I'll tell you that if it happens to somebody that's, just for instance, that's maybe pregnant, they're going to come to you and they're going to be freaking out. You know, they might think when they get this training, no big deal, I don't even want to listen to this or whatever. But if they, you know, consider themselves high risk at the point it happens, and it happens, they're going to be freaking out when they come to you. And if I haven't had to deal with this for years, and I really don't know what I'm supposed to do, you know, I'm going to be like stressed out. So I think it's an opportunity to like do a little tabletop drill and put yourself together a checklist. Somebody comes to me, and this is what happens. I'm going to just check these boxes. Did you perform first aid? Meaning, did you irrigate your eyes? Did you wash the area for a lengthy amount of time with soap and water? What forms am I going to pull out? Which doctor's office or emergency room or urgent care are we planning to send this, you know, worker to? And am I going to send this form with them? And really, you know, just kind of go down that list. You are, as the employer, should be, if an exposure happens, should be sending the employee to a healthcare provider immediately, essentially. Again, for purposes of, you know, if an exposure happens and the potential is there that the source where the blood came from is infected with HIV. In an ideal sense, the employee could receive medication to prevent that transmission of HIV, and in an ideal world, it's given within 2 hours of that exposure to blood. In a non-healthcare setting, that 2-hour window is like not very realistic to get somebody, you know, to notify you, get coverage for their classroom, get them to a doctor, which might not even be, you know, somewhere like within a half hour of your building, and get blood and stuff. But again, think of it as an emergency. Ideally, they would be treated within 2 hours, but absolutely within 72 hours. So don't delay. You should get them to a medical provider as quickly as possible to help make these decisions. When you send them, you need to be able to communicate, like on a form, to the medical provider that this person is a health para. They were deemed to have an exposure based on a needle stick or splashing a body fluid into their eyes, and give them some details, you know, of what their job is and how this exposure happened. And then would also provide them a form to send back to you for their written opinion of findings. So this would be like OSHA's record-keeping requirements. And I would say, you know, part of your checklist should be to pull up this form and just have it in a packet. Because if you send this person, you could just send them to the doctor, and hopefully they're going to take care of them as they need to. But you're going to get back like a note that has all kinds of extraneous information in it that is not relevant to you as the employer to know about, and you don't want to know about it, and you don't want to have it in their personnel files. So if you pull up, you know, online the written opinion of findings, you have a template there. You can send it, and it's really that then that the medical provider says hepatitis B vaccine was recommended, it was administered, this person is deemed to have this, you know, medical concern, do they need any follow-up? And you're getting back just the need to know information to continue to, you know, work with this person based on this exposure without extra. And then there are some definite record-keeping requirements related to this OSHA standard. You know, I won't go through them totally in their entirety, I don't think, because not everybody here is going to be the record keeper, and they're very well lined out by OSHA. But you need to maintain a file for each employee that has occupational exposure risk. It would have to have the employee's name, social security number. This is where you would put their hepatitis B shot record or their declination form that was signed. If they you could keep their training records in this file. If they have an exposure, this is where you'd put that written medical opinion, and then any follow-up, you know, information would be kept in that record. And thankfully, you don't have a whole lot of exposures because you keep the records for 30 years. So, but that would be, again, your training records and it's really, that whole is to protect you as an employer entity, that you're keeping the records for that long, and your employee. So I said I could have had this in there earlier. I put it in a weird spot, but talking about regulated medical waste, and this is specifically probably sharps boxes, like from your nurse's office in school type settings. But some of you and there was a question I think that was asked with the last speaker about like working with medically fragile kids, and you have some nurses that do a lot more like nursing, like hands-on with that maybe generates more medical waste. But regulated medical waste would absolutely be your sharps boxes, and then any waste like you would think about like gauze, dressings, anything like that. And it's not really a volume of blood, but a volume of blood that could be released from how you're cleaning up. So like if you're cleaning up with gauze and it's saturated, it's going to drip, it's going to pour out, I'm going to be able to squeeze it out, it's going to have gross amounts of blood that could flake off. That would be regulated medical waste. Probably in general, a lot of schools aren't producing that type of regulated medical waste, but if there is certain situations, it is really up to you, again, as the employer, to kind of do your own risk assessment and say, do we generate that waste? And if you do and think there is that potential, you would need a way to safely get rid of it. A lot of times I would say that's a no, but if you have sharps boxes in your school nurse's office and there is potential that you're going to need a sharps box, you are at least generating that medical waste and need a plan for it. Put this at the end because we actually just received kind of a definitive answer about this for schools. The state does allow for sharps that you would generate like in your home if you're a diabetic, to be disposed of in a certain way because it's home use. Even if you generate a very, very small amount of needle waste or sharps waste in a sharps box, you as a school, as a business, cannot follow the home regulations for getting rid of that. It has to be, you would have a couple of options. You probably aren't going to generate enough waste that you're going to have your own contract. I mean, maybe a huge school like in Omaha or a school system would, but for smaller systems, there are certain like mail-in companies that tell you how to package your sharps container and get it to them. Or there also would allow for like transport if you had a contract set up with like a local clinic or hospital or something that agreed to take your minute amount of like 2 sharps boxes a year or something and had a contract with them that you could do it that way. But should not be following, put it in a coffee can, tape it up with duct tape and put it in the trash can, which is really like how you could be instructed to get rid of needles if you were using them in your home.
Where do you find those guidelines?
These, if you pull these up on, it's a very long web address, I don't know if you'd want to type it in, but if you pull it up on your online PowerPoints, those should be active links that would take you to them. So I will say this will take you to this specific website. That verbatim answer we got from the NDEE through an email. So I don't think, it's not going, if you go there and type in school, it is not going, you're not going to find a school should do this. You're going to find how to get rid of household waste and who qualifies for household waste. And it was definitive through our answer that schools do not qualify for household medical waste. And I would be happy if you reached out to ICAP, we could definitely forward you, the specific wording that we got there. So that kind of wraps up bloodborne pathogens in just a few slides here, and I think I'm in good time, but other considerations for just personnel safety in general is, outside of that mandatory bloodborne pathogen training, there is also other opportunities to really train staff based on their job description. And I would think that, in most situations, all staff, there would be need to talk about hand hygiene, which we're going to cover right after lunch. But talk about hand hygiene, talk about how to properly disinfect, how to and who to call if we're disinfecting or cleaning like a blood spill. But there's also opportunity for people that really, in like your nurse or health aides that working with the nurses to really document some more extensive training. So if somebody is starting, if you're the school nurse and somebody is starting with you as a health care and you're overseeing them, to really have some, they could have had a little of, no background with healthcare before, and to really be able to talk about PPE use maybe more extensively than through that bloodborne pathogen training, because it may be something they're using on a daily basis, not just when the rare first aid opportunity comes up, or if they're working around sharps and stuff in your office, to do some more extensive training and really kind of document that you have gone over this with them and that maybe even witnessed them doing certain tasks and that they're competent in that. It's important that you have a good staff illness policy, and that people, I think, may have changed a lot in 3 years, right? That people just felt the need to work through anything 3 years ago, and now I think we've all learned that, things, we don't want to transmit illness to each other, and with especially COVID being so highly transmissible, I think we learned our lesson, but really, following similar rules for staff that you do for kids. We have the big posters that talk about if somebody has a specific illness, approximately how long they should be off school so that they're no longer contagious, and following kind of those similar guidelines for staff, that staff feel comfortable knowing that if I'm sick, could be contagious to my other colleagues, and we can't have that many people out, could be contagious to kids, and that the expectation should be that I'm not transmitting my germs. And training staff, part of the annual training, recognizing symptoms of influenza and communicable illnesses, so for themselves, but then also recognizing, within their classrooms so that they are getting kids appropriately, out to the nurse to be evaluated and sent home and kept off as needed, so you're not transmitting. And then going along with the last speech, but building strong relationship with your local health department, and always be considering, exposures that potentially happened. I think they would help lead you through this. So some of the things John brought up from Central District, if there was a big exposure of something within the school, you're thinking primary focus, we're keeping these kids safe, but we also make sure we're including staff and that we're keeping staff safe and that they potentially had the same exposures and may or may not have a good vaccine record for some of exposures to things that are vaccine preventable. So you have to maintain the records, right, for vaccines for your students, but not necessarily for your staff. And I know that would be a huge job, so I'm not asking you to maintain their records or anything, but I think that there's always opportunity to provide education. If you're like a school nurse or you're in a position where you send out communication to everybody, really promote annual flu vaccines, promote COVID vaccines, promote staying up to date on vaccines. It says only about 25% of adults are truly up to date on all their vaccines. Tetanus shots, you're thinking about any of this stuff. So just really, thinking about opportunities to send out education if it's, time of year to get flu shots, have your doctor check your entire record and make sure that you're safe. If there is, we're talking about more illnesses, that could be common in school age setting later this afternoon, but say there's an outbreak of measles or something, chickenpox or something that's concerning, and you have the records for the kids if they have received those proper vaccines, but be thinking about at least being able to send out communication to staff, like if you don't think you're immunized against this, please get a hold of us, and their risk for all that they come in contact with. So, like I said, lots of references there, but a lot of them are some of those forms that I brought up. So if you don't think you have forms in place, for the vaccine declination, if an exposure happened and you needed to send somebody to the doctor, I would really just make a packet for yourself and kind of go through, again, that little tabletop. Somebody comes to me tomorrow and I'm responsible for this. I don't want it to be don't want it to ruin my weekend if it's 4 o'clock on Friday and I don't know what to do and then worry about it all weekend. I've already kind of done this tabletop. I'm going to give them their paperwork. They're going to go, and we're going to know exactly how we're going to handle an emergency. Any questions for me?
We do have a question online. And you kind of addressed this already, so just to clarify, if you have blood or other body fluids like a dirty Kleenex, if a child gets a nosebleed, or if you're cleaning up a scratch or a cut, be disposed in the biohazard bag. And I think you said if it's like copious amounts, then it should be.
Yeah, generally, kind of a good example, I think that even comes, up in schools would be like sanitary pads, like in a women's restroom. Those are generally not considered a risk for bloodborne pathogen exposure. The expectation is that, they're disposed of in those appropriate little trash cans that have a liner in them so people aren't coming in contact, but they're made to absorb and contain blood. For a small nosebleed that the Kleenex absorbs and contains that blood, it's really appropriately then disposed of in a trash can. But if there is just a major injury, that happens, and just gross amounts of blood that you're going to have to clean up, and there's you're not able to absorb it, then it would be up to the school to determine, do we have this risk for this happening in general, and if we think we do, to have the red bagged or regulated medical waste plan in place to get rid of that.
Thank you. We do have another online question. Sorry, I can't see your audience.
We just have one here, so you go with yours first, and then we have one in the room.
Okay. Are all schools required to follow OSHA guidelines regarding infection control and bloodborne pathogen exposure, and thinking about this from a private school perspective?
So from a private school, again, I'm not OSHA, but I would say that if you have more than 10 employees and you're a private employer, you definitely fall under OSHA. Then the concern, then the other side of that, like I'd brought up earlier, it would be for more of a government, county, state-owned type entity. It's not truly OSHA, but still state policies would expect that you have similar or higher level of things that you follow. And then question in the room.
In a previous slide, you said that to use OSHA-approved sharps containers, which makes me think that there might be unapproved sharps containers. How can people identify if it's OSHA-approved or not?
Okay, so the question is about on the slide with sharps containers, that it had said use OSHA-approved sharps containers, and if there is a difference for containers that are not. I probably stole that wording from somewhere. I don't know if I wrote it, but definitely in a sharps container needs to be fluid impervious. It needs to be a really hard, thick plastic that a needle or something sharp in there cannot penetrate through. It needs to have a lid that seals very tight in a way that the lid locks. So once it's full or you've gotten it to the filled line, that you can essentially lock it, and it should be a very minimal risk for anybody at that point. And then it should have some sort of designated label on it, which sometimes they are a red container and the label's kind of embedded into the plastic, or else it has that universal sticker that's kind of the dark orange that shows that this is biohazard. I don't think you probably would buy Sharp. I mean, I don't think like if you purchased a Sharps container, that probably met all those specifications. There's probably not necessarily fraudulent type Sharps containers, but I think that the risk would be that, again, there's lots of information about how to like dispose of needles in your house if you're a diabetic, and it is putting them in a like old like detergent container and closing it up, putting duct tape around it, and you should not be using something like a process like that in the school.
I'm going to piggyback that because what I have seen is like what the like hospital grade or what you would say OSHA approved, where it's a mailbox type. You put it in, it flips down, and you cannot get punctured. But I've also seen what I consider more of an individual Sharps box that has a larger hole on the top, and those I do not consider safe for a multi-use because I have actually seen, I can look in there and see the needles. Yeah. And so, yes, you can close it. It meets all the requirements that you said. It's red, but I had a huge question about that because I consider for multi-use, when multiple people are putting Sharps in, it should have the safety, like the mailbox top.
Yeah, I think that you'd want to. So then the comment was brought up for the people online that there are lots of different Sharps containers. Some of them probably have an opening big enough to stick your hand down into. There are Sharps containers that are used in like the operating room in the hospital that are like large trash cans that, I mean, I could stick my arm into it. I'm not supposed to do that, right? And then there are also the types that a lot of times you would see like in a doctor's office that it looks like you're putting mail into a mailbox. You would need to evaluate what you need for the size of Sharps you're putting in there. And in most instances, it is going to be that mailbox one, probably like you said, that is the safest. Usually those mailbox ones, they're kind of like rectangular and could easily like tip over. So they're made to be put into a holder that is mounted on the wall, and there are some regulations that it's basically written that an average height female, it's not like I'm putting it above my head to dispose of the Sharp, but a regulation for height. So you want to be careful if you use those that they are in a holder, or else they're also like more of a square shape that aren't supposed to tip over, that still have a small opening to put the Sharps into. But you'd be correct, there are some that you could easily put your hand into. Obviously you're not supposed to do that, but in a school setting where you're trying to keep kids out of the Sharps container also, you would not want to choose those. They would be OSHA approved, but it's because, in an operating room I need to be able to put like large sheets and stuff maybe that are grossly bloody into them. But you would not want to, select that probably in a school setting, because I wouldn't want little hands reaching into it or big hands reaching into it.
That concludes the online education. I would like to thank all of our presenters for their experience, knowledge, and expertise. Be sure to subscribe so you're up to date with all of Nebraska Methodist College's continuing education offerings. Thank you.